Good day. I hope this finds everyone doing well in Nicholas County or anyone else that's viewing this. I want to say thank you for tuning in. Thank you for doing the things that you've done for the past several weeks throughout this pandemic. This is certainly something new, certainly something that we've never experienced in our county, in our state, in our nation. The last time that we've had a pandemic of this nature in the world was approximately 100 years ago. So this is definitely something new, definitely something that's we hope once in a lifetime. But as such, we want to take an opportunity to just provide an update to the county, an update of where things are going. My name is Sean Wolford. I'm Director of Nicholas County Homeland Security and Emergency Management. Part of our job is to prepare the county, prepare citizens for any type of disaster, whether it be natural, man-made, or in this case, a pandemic type of event. So we want to take an opportunity just to come before you and to share a few things. One of the most important things is, where are we at right now? There's certainly a lot of questions, a lot of concern in the county as to what's going on. Today is Tuesday, April 7th. Just within the past few days, we've had the first positive cases in Nicholas County. That's created a little bit of concern, a little bit of fear amongst some people. And we just want to take an opportunity to say that your fear is misplaced. We don't want to be afraid at this time. We want to be concerned, we want to be prepared, and we want to be vigilant, but fear is the wrong emotion. We want to be prepared. Right now we have 2 confirmed cases within Nicholas County as of today, and we certainly expect there will likely be more. That's something that no one should get excited about, no one should be surprised about when it happens. It's the nature of the illness, it's the nature of any illness, whether it be flu or whether it be COVID-19. So we anticipate more positive cases. When they will happen, where they will happen in the county, we don't know yet. Certainly the Nicholas County Health Department is working daily, tracking down the sources of these. For any of the positive cases, they're doing a very meticulous background history of those people they've been in contact with. So that's the hard work that they're doing behind the scenes. Our healthcare providers are doing great work behind the scenes. Our first responders, great work out there. Public safety, telecommunicators, 911 dispatchers, on and on and on. We could list the people doing the great work out there, keeping this county moving forward. And we certainly shouldn't forget the groups that maybe sometimes get overlooked, that we don't think about in a disaster, but in this case, we have to thank our retail person, our truck drivers, people that are working at the stores and the restaurants, keeping this county moving. So with all that, we just want to remind the county that things may be as dark or as scary or as uncertain as they seem, things are bright. And I know that seems like an odd saying right now, but things are bright. And probably the most important thing, just a few facts here to throw out. As of today, there have been approximately 85 to 90 tests conducted within Nicholas County. There are certainly some of those pending results, but out of those we have 2 positives. So those numbers pretty much stack up with the percentage averages across the state. If you pay attention to the governor's press conferences, West Virginia is doing very well as far as keeping the numbers low. There's been concern about, well, maybe West Virginia isn't testing as many people. And if you look at the raw numbers, that might be true. But if you look at the percentage of population, West Virginia is equal or above the averages. And if you look at the surrounding states, we're actually above those surrounding states. So West Virginia is definitely testing the same percentages of people. And at the same time, our positive cases are low. So we're doing a great job. And that's what we want to really stress today. Over the last few days, the projection as to when this event will top out, they keep talking about the curve, the bellwether of this. A few weeks ago, it was predicted that the curve of this would be around May 1st, May 2nd. Well, because of the great work that everyone's doing, the social distancing, the hygiene, washing our hands, doing those simple steps, that's been able to be pushed back to about mid-April right now. April 15th, April 16th is the projected curve of when we'll see the peak of the virus count, the peak of the illness, the peak of, heaven forbid, the deaths that will happen. So we've been able to, within West Virginia, see that curve move backwards about 2 weeks. So that's what we want to encourage people right now today. The next 2 weeks are critical. If we keep doing the things that we're called to do, keep doing the things that we're asked to do, stay home unless you absolutely have to go out. If you do go out, make it for very essential purposes, food, pharmacy, things of that nature. Don't take the whole family. Go one person at a time and do those things that we're asked to do when we are out in public. Practice social distancing, use gloves, use a mask if you have it, use hand sanitizer to wipe down. Do not touch your face after you've been out until you've had a chance to wash. Those are simple things that we've been asked to do a lot in this pandemic, but it's really the simple things that we should be doing every single year during flu season. This is certainly something new, hence the name, the novel coronavirus, the new coronavirus. So it's stuff that we have a little bit of fear and uncertainty about, but the simple basic steps that we're asked to do, we should do every single year. And it will help us during our flu season. It will help us during any events like this. So that's what we want to encourage people for the next 2 weeks. Stay the course, toe the line, do the things that you're asked to do. We will see more cases happen in Nicholas County. We will see more cases happen in West Virginia. But by doing these simple steps, we'll keep that number low as we possibly can. So do your part. One thing that I'd shared as part of our job, we react and prepare a lot for natural disasters. In Nicholas County, we're no stranger to floods, to snowstorms. And typically, when we're dealing with those, we're at the whim of nature. If a flood happens, there's nothing we can do. We cannot put up a few boards and hold the floodwaters back. If a snowstorm happens, we're forced to deal with the snow and just wait it out. In this particular case, each and every person, has the opportunity to make the difference in ending this. One person cannot end a flood, one person cannot end a snowstorm, but each and every person, just by the simple things you do, has a direct impact on ending this a whole lot quicker than otherwise. A common question that people ask, well, what do I do if I'm sick? Or what if I think I may have the virus? Or what if I'm positive? Again, some of those basic steps that we've talked about all along, the distancing, the using masks, the practicing good sanitation come into play. But most importantly, if you're sick, whether you think it may be coronavirus, whether you think it's something else, the simplest thing to do right now is stay home. The recommendation right now is only go to the ER if it is a life-threatening situation, if you have extreme breathing difficulties. Otherwise, the recommendation right now is to call your healthcare provider, whoever that is, whoever your family doctor is. Call them first. Give them your symptoms. Tell your symptoms over the phone, and that provider will advise you whether you need to come into their office to be seen, whether you should go to the ER. But that's the first step. Stay home. If you're sick, stay home. If you don't feel well, stay home. It seems like a very simple thing, but that, again, is the most basic thing we can do. Follow the advice of those doctors and healthcare providers. And that is the advice, is just simply stay home. Call ahead if you need to. Again, if you do have a life-threatening situation, breathing difficulties, any of those things, certainly, without hesitation, either get yourself to the emergency room or call 911. That's what our office is there for. And be prepared if you do call 911 that we have instituted an additional layer of screening. There will be several different questions that will be asked just to confirm whether or not you may or may not have the coronavirus, whether you may be a carrier, may be a suspect. And mainly we do that to protect the first responders, the ambulance crews or fire crews that may be coming out. We certainly don't want to take the chance of infecting them any more than we have to. So if you do call 911, there will be some additional questions that are asked. And again, if you do feel ill, contact your healthcare provider first before you do anything else. Do not go to the pharmacy for any over-the-counter drugs. Do not just run to the ER or run to the doctor's office for a sniffle. Call ahead first. Take just those few moments to do that, and it will help everyone along. It will help your situation move through a whole lot smoother, and it will protect the people that are doing the jobs that are so critical that we need to keep them on the job for. Another question that people ask is, well, should I be tested? And there's been a lot of talk in the news about drive-up testing sites, things of that nature. Right now, it all starts with your healthcare provider, whoever that may be. They will give the recommendation, and for any of the testing sites, and there are a few within the county, a few drive-up testing sites and in-office testing sites, in order for you to get that test, you must have that written order from your healthcare provider. So again, that is the first step. If you think you may be a suspect, if you think you may have been in contact with someone else, if your symptoms just seem to match up with what you're hearing on the news as far as the coronavirus symptoms, call your provider first. That is the first step to start the process to get the care that you need. And if it does seem like that you will need the actual viral test, your provider will give that documentation, issue that order, and you'll be able to either take it within that office or be sent to one of the testing facilities within the county. And if you don't have a regular healthcare provider or regular family doctor, certainly you have various options. Quick care facilities such as MedExpress will take any patients. They are a testing facility as well. Certainly you can call Summersville Regional at the hospital. They can put you in contact with either a provider or one of their own. So there are various options out there if you don't have a regular, normal day-to-day healthcare provider. That certainly will not stop you from getting the care you need or the testing you need. Whatever the nearest facility is, if you don't have a regular provider, again, the hospital, MedExpress, Camden Family Health, it can go on and on. There's several providers, and it all starts with just a simple phone call, and you'll be put in the right direction. If you need more information, visit coronavirus.wv.gov. That's the clearinghouse for the state information. It gives all kinds of details as to what's going on, all kinds of details as to how you can do your part. And the most important thing that I want to share is what I started with. The uncertainty and the fear that comes in this case. A common theme that is given in emergency management is don't be scared, be prepared. Now is the time to do that. There's no need to be afraid. There's no need to be fearful. There's no need to blame others. We have a tendency when we hear of people getting this illness to point fingers and ask where have they been, or have they infected me? Well, now's not the time for that. Now's the time to do those simple steps to protect yourselves and your family, and it will bring an end to this a whole lot quicker. So do those things. If you have any questions, visit the website that I just mentioned. Feel free to call the Nicholas County Health Department, our office, Nicholas County Homeland Security and Emergency Management. And say thanks for those people out there doing the hard work, those first responders, those healthcare providers, those retail employees that are doing such a great job in keeping things moving. And finally, just remember this, whenever we do hit the peak, and we will, remember that that's not necessarily the end of this. This virus will not go away in a few weeks when warmer weather gets here and these counts go down to near zero. This is something that we'll have to deal with, the same as we deal with the flu each and every year. This is a virus that's here until such time as they have a vaccine for it. So remember those basic steps. The steps that we do to protect ourselves from coronavirus, do the same thing to protect yourself from flu or any other illness. And it'll keep our communities safer, our communities healthy, and it'll help us thrive as we move forward. And that's the thing that we hope and we pray for, is that we as a county thrive, we move ahead stronger, we come out better and more resilient than we are right now, and that you as individuals and households are prepared. So certainly we'll be looking forward to opportunities to share more information as this moves forward, and just ask that you keep doing your part. Thank you.